Hi, it's Liam from Muscle Doctor, and today we're looking at treatment of the triceps in the prone position.
So with the client in prone and arm hanging off the edge of the couch, we're going to make sure the wax is to hand. We don't want to be forgetting that when we need it. Lift the arm up and swiftly bring your leg underneath their arm. So now we've got the arm or the shoulder girdle in retraction, and we can lift this up, work into the deltoids and triceps, and a bit of forearm there as well. So wax to hands, spreading on the skin. Let's move with some effleurage with pressure towards the heart. You'll see that I'm not in the strongest position here because of where I am. I can't really push into the stroke, but we don't need to go too deep here. What we do need to be careful of is the inner part of the arm, the ventral side. We've got veins, arteries and nerves in there, and it's going to be quite tender, so try not to put too much pressure in at that bit. Let's move to some petrissage and just try and engage with what it is you're palpating here. With the fingers we can feel some brachioradialis and then into some brachialis. And we can work up as far as the deltoids. Thumbs are going to interact with triceps, and we can pass over the different heads there. Long head at the back. That one crosses the shoulder, so just keep that in mind when you are finishing the stroke up towards the shoulder. We can go in with some deeper effleurage, just leaning body weight through an open palm. It's quite broad, but it doesn't take much pressure here. Keep that one continuous stroke going, one hand after the other. I think petrissage is the most effective stroke in this position. So now let's move into some petrissage for the deltoids. Trying to isolate all three heads. We've got posterior, lateral, and then anterior around the front. And depending on where you put your emphasis, whether it's through fingers or through thumbs, you can affect the different heads of the deltoid. So as we start to pull distally with the fingers, the pressure coming through the fingers, lifting up with their body weight, pushing down into your fingers, which gives most of the power of that stroke. We're going to get long-headed biceps. The majority of that's going to be the tendon. So just go steady there, that can cause some pain. Anterior deltoid. And let's give that one continuous stroke with the same thing happening with both hands. Back into some petrissage. There's a little muscle just down this end called anconeus. It's right between the lateral epicondyle and the olecranon process. It's an extensor of the elbow, and if the triceps are tired and fatigued and overworked, this is definitely going to be doing some of that movement. So it's small, but not insignificant, so don't forget it. Be careful when moving around to the medial epicondyle. We've got the ulnar nerve in there, between medial epicondyle and olecranon process, so that is going to be painful. Try to avoid it. Make sure you're covering as much square footage of the triceps as you can. And then finishing the stroke with some broad effleurage. Thinking about flushing things through.